Maxwell Baptist Medical Center has become one of the sites chosen in the country to begin performing a revolutionary new heart procedure.
It's an aortic valve replacement that's minimally invasive.
Yeah, and tonight Stephanie Bell Flint has a story of the very first patient to receive this life-saving operation.
We thought right then that he would be a good patient for this. We knew the technology was coming.
88-year-old Bill Toole doesn't just have one cardiologist, he has a team of them from the Jackson Heart Clinic. Toole actually volunteered to be the first to get the newly FDA-approved SAPIEN valve.
I knew this was going to be a good operation, and it has been, and it's going to continue to be one.
Toole had aortic stenosis, but his health wasn't good enough for surgery. If it hadn't been for the SAPIEN valve, he would have had no options.
Normally we replace aortic valves by opening the chest and going on the heart-lung machine. This allows us to do the procedure through a small incision in the groin.
In the operating room, cardiologists and surgeons work carefully to restore the blood flow to Toole's heart and the rest of his body. Dr. William Harris explains how the procedure works.
The device is mounted in a steel frame, so once the device was put in through the aortic valve, a balloon was blown up. It expanded the valve into where his normal aortic valve was, and literally within 3 seconds he had a normal functioning aortic valve.
Watch this video demonstration closely. You can see the compact steel frame in the center, and when it's in place, you can see it deploy. This is the actual video of the procedure being done on Toole. The valve is being positioned, and once it's deployed, the blood flow is restored.
There was no obstruction to blood flow at all coming out of his heart. So I guarantee you're going to feel better.
There's no question his mortality at 1 year would be 50%. And now that with a new valve in place, this has created, obviously improved that significantly.
Toole's doctors think he's brave. This man, who sneaked into the military at age 16 to fight in World War II, totally dismisses the thought.
I wouldn't say that. We had a lot of brave men I didn't come home with. But we were young and foolish, and we did what we could.
For Medical Matters, I'm Stephanie Bell Flint.
Toole was discharged from the hospital the day after his procedure.